Hello everyone, welcome to my channel. Do you think it is safe to get manicure done? You might be wondering, what am I asking? Most of you might be getting your nails done, right? Some of you might even get like acrylic nails done. So did any one of you experience any sort of skin irritation or like there's some difference in the nails after you got your manicure done? It is possible. If you develop contact dermatitis, it is a condition where you develop severe itching, and that can be caused in few people if they are allergic to acrylate. Now here you can see on the screen that a nail technician is doing the procedure and the person seems to have perfect nails done. But if the person is allergic to acrylate, she might develop a severe itchy condition. So our nails always give us a warning signs. So what are the different kinds of warning signs of nail, and when do you see it? So let's begin. So first condition I'm going to talk about is koilonychia. In Greek, koilo stands for hollow, whereas onyx stands for nail. These are also called as spoon nails. Now, if you see over here on the screen, let me just use a pointer. So here, if you see on the screen where I have marked, the nail actually looks like, a spoon at the end where it can hold an amount of liquid. So that's why it is called as spoon nails. And usually this condition can be caused because of iron deficiency. And the nails are usually soft. So one condition is the person might be having iron deficiency, or the person might be experiencing something called as a disorder where the blood might be slowly being lost from somewhere, like in a cancer situation, or it can be idiopathic, that is, the cause is not known. So it's always better to get your iron levels checked in case you feel like you have this sort of condition. Now, clubbing. So you might have noticed your doctor might ask you to do this symbol, which you see on the screen over here, like to put, you can try right now while you're listening to me, try to put your fingers in that way as seen. So in the normal condition, you will notice, like, how should I explain you in simple words is, if you try to do the normal sign that is displayed on the screen with yourself, you can see a tiny amount of light passing through that window. And in case you do not see any amount of light passing through the window, or what I mean is there's no gap over there, then it is called as clubbing. So shamrod sign indicates clubbing. Now, when can you notice clubbing? Clubbing is usually actually caused because of proliferation of connective tissue and bone. It can be hereditary, it can be a sign of heart disease, and it can also be a sign of lung disease. Now coming to buolines. Now, these can be caused if there is any infection, like you can see like indents on the nail, like you can see like a pitting kind of a thing. That can be because of deficiency in calcium, also called as hypocalcemia, or it can be because of a systemic disease. In case of patients suffering with chemotherapy, they actually have a pattern of lines on their nails. Those are also called as buolines. And it can be in the patient suffering with coronary disease. And recently, patients recovering from COVID or the patients suffering with COVID also have these pattern of lines. Now coming to melanoma. So melanoma is a very dangerous disease, and you might get it confused by just discoloration of the skin, but it is a discoloration that doesn't go off. That's how you can diagnose if you're trying to understand the difference between a bruise and melanoma. So many things can cause, and here on this nail you can see a line. If that line doesn't go off on its own, then it might be melanoma. Now, if anyone notices any kind of the symptoms that I'm explaining in this presentation, please go check with your doctor. These pictures which I'm explaining with is mainly for educational purpose, so that you guys are familiar with different sort of conditions. So if you're allergic to acrylate, then you wouldn't want to go and get a manicure done, because you'll be ending up with severe disease, and you might have to tell your dentist that, you know, I do have a problem, I have an allergy to this substance. And if you're getting any, if you're going for any orthopedic surgery, and you have to tell your doctor that you have this allergy. So that's the reason I'm telling. Now coming to the next, it is leukonychia. So everyone who's watching till now might be surprised that, oh my God, I had this. So does this mean I have some disease? Because actually, even I have this condition. This is nothing that's very dangerous. It's actually a very common thing. And what happens in leukonychia is nothing but these marks are usually associated because of trauma to nail. And let me tell you something interesting. Here you see only like dots of white spots here and there, right? But your whole fingers might be covered with white color, which will actually look like as if you have got a full white manicure done. That is just because of a genetic mutation. So please let me know in the comments below if any one of you have these tiny dots on your fingernails. Now, this is the condition I have explained earlier. You can see the lady has a perfect red nail polish, but then below the nail, you can see how badly her nail is damaged. That is because of methacrylate, which is there, the chemical which is used in the nail polish, and this different substances. You know, I'm talking about shellac nail polish and different kinds where you're getting like the artificial nails done. That can cause a reaction. And like I told you, it is also seen in dental materials and orthopedic substances, so be careful about it. Nail pitting can be seen in skin diseases like psoriasis. So if there is any skin infection, you can notice a little bit of the nail splitting. Now coming to splinter hemorrhage. So here what happens is you can see just 1 to 4 dots of some bluish blackish discoloration on the right side on the screen. This is actually because of rupture of bleeding of blood vessels. Now, what do I mean by that is, what happens is there might be an emboli that can travel from the nail to different part of the body, and it is actually indicative that your blood vessel has been ruptured. Okay, and it can be caused because of infective endocarditis and different kind of infections. Yellow fingernails can be sometimes due to fungal infection, but it can also be because of some other diseases like an underlying lung disease. So whenever you see that, you know, you are having some kind of discoloration which is not normal, other than the leukonychia, which I have spoken about, please tell your doctor. And if you're still, you know, if your doctor says it's fine, but you have that feeling, no, you notice some changes that is not normal, make sure that you ask your doctor different questions on like, how did you come to such conclusion that, you know, there's nothing wrong with my nails? Could you run a few tests, and like, could you tell me, how are you sure, so that you get an explanation. Now coming to half and half nails, chronic kidney disease patients might have it. So dialysis patients would 90% have it, and CKD patients who have received kidney transplantation might not have it, but majority of CKD patients do have half and half nails. So I hope you have understood about different warning signs that your nails give. And if you found this video interesting, please leave a like, share, and subscribe. Thanks for watching.